The Covered California application for health insurance can be confusing, but if you understand why they are asking certain questions, then most of the answers are easy. However, every family situation is different and some answers may not be clear. This is a high-level overview of the foundation of the Affordable Care Act rules to determine eligibility for the premium tax credits and the questions on the Covered California application. Hi, I'm Kevin Canals, Certified Insurance Agent for Covered California. Today I'll be going over some of the basic questions on the Covered California application for health insurance and eligibility for the monthly premium tax credits. Every family situation is different and you may have more questions. I encourage you to reach out to Covered California and the customer service line, or if you're working with an agent, contact him or her so they can elaborate and answer more of your questions. The first thing we have to realize is that the foundation for the eligibility and enrollment in health insurance for the subsidy through Covered California is rooted in the rules governed by the Internal Revenue Service. An individual's household eligibility to receive the premium tax credits for health insurance is based largely on the modified adjusted gross income and household size reported to the IRS on their taxes. My analogy is that the premium tax credit is like the child tax credit families can take when they file their taxes. If a taxpayer has a dependent child that is eligible for the $1,000 child tax credit, he or she claims that when they file their 1040. Similarly, if individuals or families have enrolled in a health plan through Covered California, they calculate how large a premium tax credit they are eligible for when they do their taxes. Unlike a child tax credit that is one lump sum when you file, the premium tax credit can be broken up into monthly amounts. These monthly amounts are paid to the health plan of your choice to reduce your monthly premium. And that is the job of Covered California, to help you determine how much premium tax credit you are eligible for based on your household size and income. If everything works out, the premium tax credit advance to your health plan on your behalf will be equal to the premium tax credit that you calculate when you do your taxes. One of the first questions before you enter any information on the Covered California application is if you want to be considered for either no-cost Medi-Cal or low-cost health insurance with tax credits. If you answer no, you will not be asked any household income questions and you will not be offered any advanced premium tax credit subsidy. It is very difficult to change this answer once it is selected. It sets the options for the rest of the application. The primary applicant or contact is the account holder. The primary applicant is not necessarily applying for health insurance. The primary applicant can be an adult who is enrolling a spouse or a dependent in health insurance and may not be on the health insurance policy. You generally don't want to make a dependent the primary applicant. This can cause issues later on if the primary applicant is no longer part of the household. You will be asked to confirm your identity. This can be done by answering 4 questions from the Federal Hub or uploading a photo ID. Young people or those who have been out of the country for several years may not have enough history for the Federal Hub to pose questions such as what street you lived on, high school you graduated from, or the lender for your home mortgage. Agents can attest to visually verifying a person's identity by uploading a photo ID such as a driver's license. Household members are everyone who the primary tax filer claims on their federal tax return as either a spouse or dependent. A roommate or relative who lives with you but is not part of your tax household is not part of your Covered California household. Household members included on the Covered California application, even if they are not requesting enrollment in health insurance, are the people listed on the tax filer's 1040 form. The application will ask if the person wants health insurance. By selecting no, the person won't be included in the final eligibility determination for health insurance. Valid reasons for selecting no are the person has Medicare or employer-sponsored health insurance, but they are still part of the household size, which determines certain aspects such as the size of the advanced premium tax credit or whether dependents 18 years and younger qualify for Medi-Cal. Based on the household size, if the income is below 266% of the federal poverty level, dependents 18 years and younger will be determined eligible for Medi-Cal. In other words, they will not be eligible for a private health plan with a tax credit subsidy. If the household member is a legal permanent resident, You will need all the necessary documentation and numbers to enter into the application. There are a variety of residency statuses that qualify to be included for health insurance through Covered California. Check the Covered California website for details and the necessary documentation. The next set of questions deals with the demographics of the household members. The question, does this person have a physical, mental, or emotional developmental disability, is usually referring to disabilities that have been recognized by the Social Security Administration. If you select yes, that person's information will be sent to your local county social services department for review. They may be awarded Medi-Cal if they are determined eligible. Requesting Medi-Cal help pay for medical expenses or help with long-term care will also trigger referral to your local county social services department, but may not exclude that person from enrolling in a private health plan with the subsidy. There are numerous programs to help people with prior health care expenses and disabilities, and they want to make sure everyone has access to those programs. If you answer yes to being a member of a federally recognized Indian tribe, you will need to provide proof in order to enroll in one of the Native American Indian health plans. The primary tax filer is the person who files the household federal tax return with their Social Security number at the top, not the spouse's Social Security number. The primary applicant is not always the primary tax filer. If the wrong person is selected as the primary tax filer, the system may not be able to determine eligibility for the tax credits. This can result in the household receiving no tax credit assistance. Consequently, it is important to select the right household member as the primary tax filer. If you are married, you have to file a joint return in order to be eligible for the tax credit subsidy. Spouses are not considered dependents on the tax return and should not be marked as a dependent on the Covered California application. When filling out the tax questions for dependents, you want to make sure that it aligns with the tax household. These questions are meant to verify that the person listed truly is part of the taxpayer's tax filing household. Some children do need to file a tax return for earned and unearned income, but that won't necessarily make them ineligible for the tax credit subsidies. But if the dependent must file taxes, make sure to include it in the household modified adjusted gross income. Covered California will ask if any of the household members are enrolled in other health insurance plans. If any box other than none of the above is checkmarked, the person will not be eligible for the monthly tax credit subsidy. The income section is greatly improved from the original Covered California application release in 2013. The current program will walk you through adding income for all family members. This part of the application is very date sensitive. If you enter an incorrect date for when an income started or ended, it will impact your monthly and annual estimated income amounts. Always double check to make sure the monthly income is correct along with the annual income. If the monthly income is too low because of an error entering the dollar amounts or a date, the whole family may be determined eligible for Medi-Cal. Once you are determined eligible for Medi-Cal, you will have to work with your local county Medi-Cal office to verify that you actually earned more than was incorrectly reported to Covered California. Once you have confirmed your monthly income is correctly entered into the Covered California application, you can then submit it for an eligibility determination. The Covered California system will return an eligibility report with the expected premium tax credit and how much will be applied toward reducing your monthly health insurance premium. The eligibility page will also list the determination factors on what programs you qualify for. If the page says you are not eligible for the CSR program, that means your income was not low enough in order to qualify for an enhanced Silver, 73, 87, or 94 plan with the cost-sharing reductions. The list will also include reasons why you are not eligible for the advanced premium tax credits or are eligible for Medi-Cal. If you think something is amiss, such as the program determined you are eligible for Covered California and private health insurance, but awarded you no subsidy, refer to the factors to determine a possible error on the application. Some problems may not be easily identifiable from the listed factors. This means you will have to go through and scrub your application looking for any possible errors, such as listing the wrong primary tax filer or filing status. You may have to report a change to correct application information. Your Covered California agent or customer service representative should be able to assist you with reporting a change to correct the information.